Okay, you all okay? So can we continue our lecture? Alright.
கேப்ல என் ரூம் கார்னர்ல ஒரு பூச்சி கத்துற சவுண்ட் கேட்கும்.
Okay, Alhamdulillah, since you are all okay, can we continue our lecture? Okay, for anti-migraine drugs, there are two types of anti-migraine drugs that we are going to discuss. First is the triptan, second is the ergotamine. For triptans, okay, triptan mostly it reacts with the serotonin 1B/D1 receptor agonist, while the ergotamine react with the alpha adrenoceptors, serotonin receptors, and also dopamine receptors. Okay, triptan, there are two generations of triptan. First generation is a sumatriptan. It is not readily cross the blood-brain barrier. Second generation of triptan like azamitriptan, naratriptan, rizatriptan, elmotriptan, flavotriptan, and also alitriptan. Banyaknya triptan. And it's available to penetrate the blood-brain barrier and inhibit the trigeminovascular activity. Okay, the possible mechanism of action of sumatriptan, it can cause the cranial vasoconstriction by stimulated by the serotonin 1B. It also can be peripheral neuronal inhibited, stimulated by the serotonin 1D. It also can reduce the excitability of neuron in the trigeminovascular system, which is stimulated by the serotonin 1B/1D. To be taken at earlier sign of migraine attack for maximal effect. Okay, for the pharmacokinetics, the absorption from the gut is rapid but erratic. Second generation have better absorption. Metabolized by the MOAA and the cytochrome P450, then excreted via kidney. And the half-life is about 2 hours and time maximum is about 12 to 50 minutes. For the adverse effect, patient may be experience the tingling, heat, heaviness, pressure, or tightness of any parts of the body. 15% of patients report chest tightness, pressure, heaviness, or pain in the chest, neck, and also throat. It can be flushing, dizziness, and fatigue, nausea, and vomiting. So please be caution to the HAD patient, uncontrolled HHPT, and also cerebrovascular disease. For the drug interaction, it may have interaction with the ergotamine derivatives, so we need to allow 24 hours interval before triptan is given, and it also may interaction with the MAO inhibitors, which is monoamine oxidase inhibitors, are chemical which inhibit the activity of monoamine oxidase enzyme A, and it is used for medication prescribed for the treatment of depression, which is need about 2 weeks for interval. Okay, for commercial preparation, it is a sumatriptan in 50 mg, 100 mg tablets. The dosage, it can be 50 mg or 100. And patient information, it may cause the drowsiness. Okay, now we move to the ergotamine. Ergotamine produced from the fungus that infect cereal crops. Low cost and long history of usage since 1925. Adverse reaction is a common and potentially serious, superseded by the triptan. Precise mechanism of action is unknown, but it believed that has a agonist, partial agonist, or anti-agonist of the serotonin, adrenergic, and dopamine receptor. The molecule shares structure similarity with neurotransmitter with such as serotonin, dopamine, and epinephrine, and cause thus bind to several receptor acting as an agonist. A group alkaloids such as hydroergotamine affect the pathophysiology of migraine via serotonin 1B/D receptor on the meningeal vessel. Ergotamine also has effect on the dopamine and norepinephrine receptor, and the anti-migraine agent act by cause the vasoconstriction of the corneal arteries and inhibit the trigeminal neurovascular system.
You faham tak?
Okay, for the therapeutic use of ergotamine, it is used medically for treatment of acute migraine attacks, sometimes in the combination with caffeine. It is used to prevent postpartum hemorrhage, like a bleeding after the childbirth. For the pharmacokinetics, it is usually combined with caffeine to improve the absorption in the GI. Ergotamine absorption is poor and erratic and extensive first pass effect. For adverse effect, it may cause the patient to experience the nausea, vomiting, severe abdominal upset, muscular cramp, and lastly, lastly is the ergotism, like a peripheral gangrene, convulsion, hallucination, and also ischemia. Okay, for commercial preparation of ergotamine available here, like a 1 milligram plus caffeine for about 100 milligram. And for the patient information, tablet must be taken at first sign of migraine attack. Okay, delay may render the drug ineffective and other drug therapies needed. Drug course do not more than twice per month to avoid the habituation, and stop treatment and contact doctor if numbness or tingling of extremities develop. Okay, please follow the instruction. Don't be like this.
Mematuhi.
Memantoi,
Mematuhi.
memantoi,
Mematuhi lah. Okey lah, mematui.
Okay, for prophylactic drug, therapy to prevent migraine is indicated if the attack occur 2 or more times in month, and if the headaches are severe or complicated by serious neurologic signs. Administered on the daily basis to reduce frequency, severity, and duration of headache. Use when abortive treatment use more than twice per month, or overuse of abortive treatment. Headache are severe and complicated by the neurologic sign. Headache are not responsive to abortive treatment, and also abortive treatment for the clinical indication in patient. Okay, example like pronolol, pizotifen, and also amitriptyline. Okay, propranolol is the drug of choice, but other beta blocker, particularly danolol, have been shown to be effective. Alright, thank you for watching this video. Okay, I hope after this you can read by your own. Okay, please study. Assalamualaikum warahmatullahi wabarakatuh.